The Board of Directors of the Midwives Alliance of North America has had a transformational 10 days together. First, we started with a very powerful and successful conference in Nashville, Tennessee. Our theme was returning to our roots and sowing seeds for our future. We were reminded on whose shoulders we stand: the grand midwives, the indigenous midwives, the immigrant midwives, and we were also challenged to look to the future. So here we are at the farm in Summertown, Tennessee, another place of historic lineage for midwives, where we just completed a 5-day strategic planning session for the Midwives Alliance. We realize that we stand at the cusp of one of the greatest opportunities and potentials for healthcare transformation in the United States, including maternity care reform. We know that midwives are the solution for offering safe, satisfying, and cost-effective care, but also for overcoming disparities and saving the lives of mothers and babies. I'm offering the 2020 challenge. 20,000 midwives doing 20% of the births in the United States by the year 2020. I'd like to share with you an overview of our new strategic plan. Our vision is a robust, representative, and sustainable professional organization, the advancement of the profession of midwifery, and a cultural shift to midwife-led care. This vision is implemented by the following 4 strategic directions. Number 1, launching a social justice agenda. Number 2, engaging in political advocacy. Number 3, developing organizational capacity. And number 4, increasing public awareness and education. So I'd like you to hear more about them in detail.
We are launching a social justice agenda. This new agenda is rooted in the multiplicity of approaches to advocacy as defined by the needs of all women and families. Our social justice priorities reorient the work of the Midwives Alliance to adequately support populations who experience intersecting challenges to equitable maternal-child health care. We embrace our responsibility for addressing and overcoming disparities in outcomes for mothers and babies, and we invite you to join us in this important work. It will take unity of purpose to implement this exciting social justice agenda with fluidity, creativity, and full accountability.
First is our membership drive. We realize that our membership is invaluable. We must bring more members into MANA. In order to strengthen our voice and our capacity to move forward, we will be offering incentives for memberships over the next 3 years, both for renewals and for new members. Also, we will be activating our legislative committee to study state-by-state laws that pertain to midwifery and maternal-child health and to support the movement in these areas. Our vision of being part of a federal agenda will continue with our presence within the MAMA campaign, with 6 national organizations advocating for the recognition of CPMs. We are also involved with a coalition of 8 more national organizations to pass federal maternal-child health care legislation, particularly the Moms 21 Act. We are investing in a legislative agenda to ensure midwifery presence at the local, state, and national levels, with a distinct direction of addressing all marginalized communities and the discrepancies and disparities experienced within those communities.
Our organization is changing and growing at a rapid pace. To keep up with all of these changes and in order to serve our MANA members more efficiently and effectively, one of MANA's new strategic goals is developing organizational capacity. Some of the ideas we have to fulfill this goal are: first, restructuring MANA committees into a division model that includes already existing committees and reactivating committees such as the Legislative Committee, as well as forming new committees that focus on social justice, public relations, social media, and global outreach. We are hopeful that this new model will give enthusiastic people specific places and tasks to plug into to help move the midwifery model of care forward. Second, implementing a plan to increase MANA membership while creating more positive and practical incentives for members. We are aware that the membership is MANA and there is strength and passion in numbers. Third, creating a mentoring program to encourage and guide new MANA leadership. MANA is nearly 30 years old, and many of the founding mothers are still involved in the work of MANA. We know that we need to teach and mentor younger women who will carry the midwifery torch forward. And fourth, hiring paid staff to help us meet our goals. Specifically, we are considering increasing the interim executive director position to a full-time executive director and hiring a development director to fundraise. We know that the work MANA has to do cannot be done just with volunteers any longer. MANA must be able to respond and work with other organizations that are working to improve maternal and child health. Improving our organizational capacity will launch us into the national stage and put midwives within the healthcare conversation.
We recognize that conveying to the public the enormous benefits of midwifery care is vital to shifting from a medical model of obstetric care to a midwife-led model. We also recognize the importance of communicating to our members about the entirety of the work our organization is doing. An increasing number of organizations are using social, print, and web media to engage with a broader community. The growing popularity of social media sites like Facebook and Twitter increase our capacity to disseminate information and interact with members and others who are interested in our work. In the coming weeks and months, the Midwives Alliance will refocus our efforts to enhance our media presence and increase our visibility. Our next steps include hiring a media intern, redesigning our newsletter, unveiling a new and more accessible website, launching a monthly e-news, increasing advertising for our Mothers Naturally campaign, establishing a presence on Facebook, Twitter, and YouTube, increasing our blog contributors, and supporting our ability to communicate more effectively with our members.
As we approach the 30th anniversary of the Midwives Alliance, we are leading our organization into a bold new direction. We invite each of you to support us as we make midwife-led care the norm. Join us as we continue to build alliances for the benefits of mothers, babies, families, communities, and midwives.
I'm a midwife.
I'm a midwife.
I'm a midwife. I'm a midwife.
I am a midwife.
I'm a midwife.
I'm a midwife.
I am a midwife.
I am a midwife.
I am a midwife.
We are the Midwives Alliance!
Woohoo!